The coronary arteries are important blood vessels that supply oxygenated blood to your heart. Sometimes cholesterol plaque buildup can cause a narrowing of the arteries and a dangerous reduction in blood flow. A coronary angioplasty with a stent placement is a procedure which doctors use to open up narrowed coronary arteries. If you have a narrowed or blocked coronary artery, the doctor will navigate a guide wire through a guiding catheter placed in your arm or thigh up to your heart via the arterial system. He will use an X-ray device known as a C-arm to monitor progress. Once at the heart, the doctor will direct the wire to the other side of the narrowing. On that wire, the doctor will pass a balloon-tipped catheter into the center of the narrowing. He will then inflate the balloon one or more times, compressing the plaque deposits against the wall of the artery and thereby improving blood flow. Many times, a second balloon-tipped catheter is inserted, but this one is encircled with a metal stent. When this balloon is expanded, the stent also expands and its mesh-like structure locks permanently to the wall of the artery, providing support and preventing plaque from building up again, thus improving blood flow to the heart.